We've heard from a lot of you lately, especially folks who are either dealing with some new health stuff themselves as they're getting older, or maybe helping loved ones through it.
Uh-huh.
And one thing that keeps popping up is this RF test, the Rheumatoid Factor Test.
Right.
So we thought, let's really dig into this.
Yeah, good idea. It can be a bit of a head scratcher.
It can. So we'll break it down plain and simple so that you understand what this test is, why a doctor might order it, and then what do those results even tell you?
Exactly.
So first things first, what is this rheumatoid factor thing?
Okay, so rheumatoid factor, it's a protein, right? And your immune system makes it.
Okay.
Now, usually our immune system is the good guy, makes antibodies to fight off those nasty bugs. But sometimes it kind of gets confused.
Oh.
And instead of attacking germs, those RF antibodies, they start attacking healthy cells and tissues in your body.
So it's like your own body working against you.
Yeah, kind of like friendly fire, unfortunately.
Yeah, cockhead.
It's not good. And here's the thing. Lots of healthy people have some RF in their blood. It's not automatically a problem. But when we start seeing symptoms along with it, that's when we pay attention.
Right. So symptoms plus the test result equal a clearer picture. So tell me, what exactly does this RF test involve, and why would a doctor even order it in the first place?
So the RF test, it's a blood test, pretty straightforward. It measures how much of this rheumatoid factor protein is hanging out in your blood.
Okay.
And the main reason we use it is to help diagnose something called rheumatoid arthritis, or RA.
An RA, for those who might not be familiar, what exactly is that?
So rheumatoid arthritis, it's an autoimmune disease, which means, again, the immune system has gone a bit rogue. It's attacking the lining of your joints, causing inflammation, pain, swelling, all that fun stuff.
And I imagine that's not pleasant.
No, not at all. And it usually starts in the smaller joints, like your hands, wrists, feet, and usually the same joints on both sides of the body. And here's the thing, it's chronic, so it can stick around for a while. And it's not just the joints. It can also affect other organs in the body, which is something to keep in mind, especially when we're talking about older adults.
So not your average aches and pains then. This sounds serious.
It can be, yeah.
Now, I know you said the RF test helps diagnose RA. Does it give us any other information? Like, does it tell us how bad it is or anything like that?
It can, actually. Sometimes the level of RF, it can give doctors a hint about how severe the RA might be and how likely it is to cause problems outside the joints. So if someone has really high levels of RF, it might mean their RA is more aggressive.
Gotcha. So it's not just, yes, you have it, or no, you don't. The amount matters.
Exactly.
But I'm guessing the RF test isn't the be-all and end-all for diagnosing RA.
You're right. It's just one piece of the puzzle. Doctors will look at the RF test, but they'll also do other blood tests to check for inflammation. They'll listen to your symptoms, like that morning stiffness we talked about, and they'll go over your medical history.
Right. It all adds up. Now, we're talking about joint pain, and I know a lot of people, especially as they age, deal with osteoarthritis.
Uh-huh.
Is the RF test used for that as well?
Good question. It's important to understand the difference. We don't use the RF test for osteoarthritis.
Okay.
Both can cause achy joints, but they're different beasts altogether. Osteoarthritis, that's wear and tear, cartilage breaking down over time.
Just from using your joints?
Pretty much. It's not an autoimmune disease, so it doesn't involve rheumatoid factor. It's a key distinction, especially as we get older.
Got it. So RF test for the autoimmune stuff, not for the everyday wear and tear kind of joint pain. Makes sense. So when would a doctor actually order an RF test? Like, what are the signs that would make them think, okay, let's check this out?
Well, usually they'll consider it when someone has symptoms that might point to rheumatoid arthritis. So we're talking about joint pain, of course, but not just any joint pain.
Right.
It's more like pain in multiple joints, tenderness when you touch them, swelling, warmth around the area. And one thing that's pretty typical is stiffness in the joints, especially in the morning. That lasts for a good while, like more than 30 minutes.
So not just that feeling of, oh, I slept funny kind of stiffness.
Exactly. That
Yeah.
morning stiffness, that's a big clue for inflammatory arthritis, like RA.
Okay, so the joint stuff is a big indicator. Are there any other symptoms that might raise a red flag?
Yeah, sometimes there are these more general symptoms, things that affect the whole body, not just the joints. So you might feel really tired all the time, more than usual, maybe have a low-grade fever now and then, or even lose your appetite. And sometimes RA can cause problems outside the joints too. Like you might have dry eyes and mouth, or develop these firm lumps under the skin, or even have anemia. So if you've got a bunch of these symptoms going on, the doctor might think, okay, let's do an RF test and see what's up.
So the joint issues are usually the main thing, but these other more general symptoms, they add to the suspicion. Now, I remember you mentioned that the RF test isn't only for RA, right? When else might it be used?
Right. So RA is the most common reason, but we might also use the RF test to look for other autoimmune disorders like Sjogren's syndrome, lupus, scleroderma, and sometimes certain chronic infections, things like hepatitis C, tuberculosis, or even endocarditis, which is an infection of the heart lining. Those can also cause high RF levels. And then in rare cases, some cancers like leukemia can be linked to a positive RF test.
So it sounds like if the test comes back positive, it doesn't automatically mean it's RA. There could be other things going on.
Exactly. That's why it's not a diagnosis on its own.
Okay, that makes sense. So let's say you go in, you get the test. What actually happens when they do the blood draw for the RF test? Is it a big ordeal?
Nah, it's really simple. They just take a bit of blood from a vein in your arm, with a little needle. Takes like 5 minutes tops. You might feel a tiny prick when they put the needle in or take it out, but it's not usually painful.
And what about those home testing kits that are becoming more popular? Can you use those for the RF test too?
Yeah, actually. There are kits where you prick your finger, get a little blood sample, and mail it off to a lab. But here's the thing. If you do a home test, you absolutely have to tell your doctor about the results.
Right, they need the full picture.
Exactly. They're the ones who can interpret the results properly, considering your overall health and any symptoms you might have.
Makes sense.
Yeah.
Now, do you need to do anything special to prepare for the RF test?
Yeah.
Like fasting or anything like that?
Usually, nope. You can eat and drink like you normally would. The doctor will let you know if they need you to do anything specific, but most of the time, you're good to go.
And are there any risks involved with getting your blood drawn? I know some people get a little squeamish about needles.
The risks are really minimal. You might get a bit of soreness or bruising where the needle went in, but that usually goes away quickly. Serious problems from a blood draw are very rare.
That's good to know. So let's talk about the results now. What happens if the test comes back negative?
Okay, so a negative result, that usually means there's not much or any rheumatoid factor in your blood. But, and this is important, especially for folks listening who are concerned about themselves or older relatives, a negative RF test doesn't completely rule out RA or other health problems. In fact, a lot of people who have RA, especially early on, might have low levels of RF, or it might not even show up on the test. So if someone has symptoms that look like RA, but their RF test is negative, the doctor's probably going to want to do some more tests to figure out what's going on.
So negative doesn't always mean you're in the clear. What about a positive result? What does that mean?
Okay, so a positive result, that means they found a higher than normal level of rheumatoid factor in your blood. But, and this is key, a positive RF test on its own doesn't necessarily mean that RF is causing whatever symptoms you're having. Okay.
But generally speaking, the higher the RF level, the more likely it is that you might have a condition related to RF. So if your test is positive, the doctor will probably want to do some more digging. They might order additional tests, ask you more questions, just to figure out if it's RA, another autoimmune disease, an infection, or in some cases, maybe even certain types of cancer.
So a positive result, it's like a sign that says, hey, we need to look into this further, not a final answer. Now, when you get the results back, how do they actually report the RF levels?
There are a couple of ways they do it. One way is using something called titers. A titer basically tells you how much they can dilute your blood sample before the RF disappears. So you might see a result like 1.20.
1 to 20.
Yeah. And the bigger that second number, the more RF you had in your blood to begin with. So a titer of, say, 1.80, that means there was more RF than a titer of 1.20.
Gotcha. Higher number on the right side of that ratio means more RF. What's the other way they report it? The other way is using something called nephelometry units. It's basically measuring how cloudy your blood sample is. See, if you've got RF in your blood, it can make it cloudy. So the cloudier the sample, the higher the number of units. For example, an RF level of 100 units means there's more RF than a level of 40 units.
Okay, so higher ratio in the titer or higher units in the nephelometry test, it all means more RF in the blood. So what's considered a normal level and what's high or abnormal?
That's a great question, and it's not always cut and dry. Each lab has its own range of what's considered normal, and you'll see that range on your lab report.
Sure.
But those ranges, they're just guidelines. Your doctor, they're going to look at the whole picture. They'll consider your age, your health, any other conditions you might have, and of course your symptoms. For instance, sometimes older adults have slightly elevated RF levels, even if they don't have RA or any other problems. So that's something to keep in mind, especially for our listeners who are older or who are taking care of older family members.
So even if the number's a bit high, It doesn't necessarily mean it's a big deal.
Right. It's all about context.
That's so important. So basically, the bottom line here is that whether your RF test is normal or high, you need to talk to your doctor about it. They can explain what it means for you, considering everything else that's going on.
Absolutely. They're the ones who can put all the pieces together and help you make sense of it.
So just to wrap things up, it sounds like this RF test, it's a really helpful tool, especially when we're trying to understand what's causing joint pain and other related symptoms, especially when we're thinking about RA, which, as we've said, is something that can become more common as we get older.
That's a good summary.
And the take-home message for everyone, especially for our older listeners and their families, is that if you get an RF test, no matter what the results are, you need to go over them with your doctor.
Absolutely. They can tell you what it all means and what to do next.
So here's something for everyone to think about. We've talked about how a high RF level can happen in lots of different situations, not just RA. So what are some good questions you can ask your doctor to really understand what your specific RF test results mean for you? Being informed and proactive, that's so important when it comes to your health.
Couldn't agree more.
Well, thanks for joining us today for this deep dive into the RF test. We hope this has given you a clearer understanding of this important topic.
It was my pleasure.
And remember, knowledge is power. Stay informed and stay well.